Colorado Springs is a community in mourning. After an incredibly difficult week, this Thanksgiving marks a time of reflection for people to come together and be with those they love.
9 News reporter Mark Salinger introduces us to the people who are trying to make everybody feel included.
A city that's in pain supports each other.
You know, everyone is feeling the same negative feelings that I am, and we bond over that.
In a week filled with far too many questions, Nicholas Watson finds healing in his community.
It brings us together so fast when something like this happens.
At Rico's Cafe in downtown Colorado Springs, Nicholas hosted an open mic night to bring people together.
And we're doing a special open mic that's loud and proud, and we're trying to get as many members of the community as we can to show up.
The shooting at Club Q happened just days before Thanksgiving.
Thank you for everything that people have done in this last few days, the days of such sorrow and shock.
Honestly, everything I've heard so far is Friendsgiving after Friendsgiving, you know, like just groups of people trying to make sure nobody's alone.
To be able to break bread with each other and be able to remember our friends that we've lost and some of our friends that are still fighting.
Hysteria Brooks helped organize a Friendsgiving at a Colorado Springs church Thursday. Club Q was supposed to host the gathering today before the shooting changed everything.
The timing of Thanksgiving coming right after this might be good, just because people will have the opportunity to see the people that they love.
From coming together in a coffee shop to finding love around a dinner table, healing is everywhere.
Maybe they at least have something to hold on to while they're grieving and getting through it.
In Colorado Springs, I'm Mark Salinger, 9 News.
Club Q has directed donations to the Colorado Healing Fund, a nonprofit effort that will support the victims' families, survivors, as well as the broader community impacted by the shooting. Since Monday, 9 News viewers have raised more than $100,000 for that effort. You can scan the QR code on your screen if you'd like to join me and others in donating. The Colorado Healing Fund is already working with LGBTQ nonprofits to make sure that the community's needs are met in both the short term and long term. The Healing Fund has already moved out donations to pay for expenses like memorial services, medical costs, and travel expenses for families.
This month, Aurora City Council passed the mayor's plan to build a big new campus filled with resources for people experiencing homelessness. There'll be different levels of service, a new emergency shelter, mental health and job training programs, and transitional housing. What do those actually experiencing homelessness want to see? Well, 9 News reporter Kelly Rinke spoke to a man who is living at a shelter.
Asking for help can be hard.
It took me a while to even justify coming here.
Sam Davis is 51 years old.
I'm currently experimenting with collages, painting.
And finally had the courage to come to this pallet shelter in Aurora.
I just want a life I care about that means something to me.
This temporary place to stay is the support he needs right now.
Well, everyone likes window coverings here. Really love the Egyptian motifs.
He thinks the mayor's idea of a big campus of resources could be a solution too.
And having as many options as possible in one location would certainly benefit the maximum amount of homeless people, in my opinion, particularly considering transportation issues.
The campus would have 3 types of service: an emergency shelter on cold nights, a place to stay for people who access programs like mental health support, and then transitional housing for those who work full-time.
Case managers. More than anything, that's what we need, is as many people as we can who are able to work with the homeless on a one-by-one basis.
So it has worked. It's worked well in other areas to have things consolidated.
Dr. Kathleen Van Horace works with a lot of service providers in the city because she helped set up the pallet shelters where Sam is staying. For the mayor's initiative, she still has questions about funding.
So in most other locations where they've done this consolidated effort, it's one of the first things they've looked at is to make sure that when you have different service providers all fighting over the same pots of money.
The city says it's working to secure money and find nonprofits to run these programs. This plan is in its beginning stages, but it's something Sam would consider going to get some help.
Cautiously sounds like a good idea, particularly for people like me.
In Aurora, I'm Kelly Rinke, 9 News.
Some Liberal members of City Council say the housing should come without strings. City Council also debated how much of the campus would be run by the city versus nonprofits, and how much to ask counties or the state to contribute. That plan is still moving through.
We may never know just how bad RSV cases got in Colorado because the state is not required to report those numbers. RSV-related pediatric deaths are not a statistic that the federal government collects in the same way that it tallies pediatric flu deaths. 9 News reporter Jaleesa Irizarry explains why.
Just as fast as wind changes direction, doctors hope RSV case counts follow suit.
We are still very much dealing with numbers of patients that we've never had to manage before.
Children's Hospital Colorado is seeing a surge of RSV. CDPHE says the Denver metro area has had more than 1,100 hospitalizations since early October. More than 90% of them are pediatric cases. But we may never know how many of those patients die. Because according to CDPHE, the state is not required to share RSV pediatric deaths since RSV is not a nationally notifiable disease. But the flu is, which makes pediatric flu deaths reportable.
Like, what is there a reason for not reporting it?
Connor O'Brien has the same question many do. O'Brien says his son Finn was recently hospitalized with RSV for 12 days. He believes reporting the number of deaths could make a difference with how seriously parents approach the illness.
So I feel like a lot of people don't really understand the severity of it unless they've either experienced it firsthand or if somebody else close to them has gotten it.
CDPHE says pediatric flu deaths were made nationally notifiable in 2004 in response to recommendations for flu vaccines in children. While CDPHE says they are not aware of any plans to make RSV pediatric deaths nationally notifiable, when an RSV vaccine is licensed, that could be a possibility.
As a parent, it's important to be aware of it.
O'Brien believes more information can always be helpful. He and others hope as the season cools down, so do the case counts. Jaleesa Irizarry, 9 News.
Children's Associate Medical Director told us he's not sure if changing the reporting requirement would change how parents approach the virus, especially this year with so much attention on RSV.
The place I always wanted to live in, I can do that now.
The Marshall Fire destroyed more than 1,000 homes. Now one architect is designing new homes for the survivors, including himself.